I'm Dr. Troy Jandutso. If you've been diagnosed with prostate cancer recently, you're probably feeling quite overwhelmed and will have a lot of questions about what all of this means and what options you have open to you. I hope that the information contained within these videos will help provide you with some clarity. Here in my practice, I have a dedicated team here to help and support you. There is myself and also my prostate cancer care nurse and a dedicated pelvic floor physiotherapist, and we're all here to help.
The prostate is the gland that sits beneath the bladder and provides nutrition for sperm.
When a man urinates, the urine passes from the bladder through the prostate and down through the penis. Typically in early prostate cancer, men generally do not have any symptoms at all. And the reason for that is the urine flows through the centre of the gland while the cancer arises on the outer edge of the gland, and therefore it does not affect urine flow. It is important to realise that prostate cancer is a very variable disease, and the way it behaves and presents in one man can be completely different to the way it behaves and presents in another man. Certainly, the earlier we are able to detect it, the more able we are to treat that cancer and get a man back to his normal activities as much as possible.
To check if a man has prostate cancer, specialists examine the prostate gland for physical abnormalities and also check the patient's PSA level.
PSA stands for prostate-specific antigen. It is an enzyme that the prostate makes that makes ejaculate fluid less viscous. We use the PSA blood test as a marker for prostate cancer. If a man's PSA is abnormal, or if the PSA is normal but rising quickly, or if the man has an abnormal prostate examination, then in those instances we may perform a prostate biopsy to take samples of prostate tissue for analysis. What happens at a prostate biopsy is you end up with some small cores of tissue. They then get examined under the microscope, and the prostate glands that are cancerous are graded depending on how abnormal they are. In essence, the pathologist assigns a grade out of 10 known as the Gleason score. Generally, a Gleason score of 6 or less is considered as low risk, 7 is intermediate risk, and 8 through to 10 is high risk. Once we have established that a man has prostate cancer on biopsy, we then need to see if it has spread, and we do that with imaging. We typically order a bone scan and a CT scan and sometimes an MRI scan.
The information provided in this video is to assist patients and their families to understand the nature of prostate cancer and various options for treatment. The information is of a general nature only. It is important before entering into any treatment to ensure that you have discussed your specific situation, pathology results, clinical presentation, and options for treatment, as well as the pros and cons of the different treatment options with a urologist. This video is not a substitute for such a discussion, and whilst it will help you to understand the condition and the options for treatment, it should not be used as the only or even primary basis for making decisions about treatment. The views expressed by Dr. Gianduzo in the video are his own opinions based on the relevant literature and his experience. Other specialists may offer slightly different opinions. You should always consider seeking a second opinion if unsure about a treatment option.